Hi, everybody. I'm Dr. Christine Anderson. I am a Los Angeles-based pediatric chiropractor, and I am coming on tonight because I thought it was important to talk a little bit about the recent CDC lowering of the speech milestone standards. I'm going to go through what they did and show you a little bit of the article that they wrote and a little bit about one particular aspect having to do with this changing of the speech milestone standards and why it's a big deal and my thoughts on it as far as what they've come up with. And as usual for me, especially being a neurologic-based chiropractor, is if they were indeed lowered, why? Why would children all of a sudden be having more issues with speech? So stay tuned. We're getting right into it, and I'm going to get into all of this. So let me get started with the actual article itself. So, evidence-informed milestones for developmental surveillance tools is the name of the article. It's in Pediatrics. It was published on February 8th of this year, and I will put a link in the description so you can go right to this study without a problem. So what happened is that the CDC funded the American Academy of Pediatrics to revise the developmental checklists of milestones. So they came up with 11 criteria, and they also did a 2019 literature search. So this is something that they've been working on for a while. Now, the goal of the 8 experts that were on this panel, and they were all experts as far as development in one factor or another, and you can read that in this study. I won't go into it too much. But their goals there were 3 things: identify milestones to put into the CDC checklists, identify when greater or equal than 75% of children were expected to reach the milestone, and then support the clinical judgment regarding screening tools, whether it be just visual screening in a health office visit or parents or whatnot. And they had 4 categories: social, emotional, language and communication, cognitive, and motor. So those were the 4 areas. And as a result of this study, this article that was written, the changes to the CDC milestone are summarized in the table that I have there. 26.4% reduction in total number of CDC milestones. 1/3 of retained CDC milestones were moved to different ages, and then 40.9% of the final milestones were new. So quite a few changes in this particular working group and what they found. So one of the things that I really want to focus on in this, because it really is a huge difference. There were a few things I saw that I would disagree with. Maybe it was a few months off, but this was a significant change in language and communication category. So first of all, they added 2 new milestone categories of 15 months and 30 months. So typically, you might see ranges of like 0 to 2 months, 4 months, 6 months, on and on. Well, these were 2 age groups that they added in. Now, of real note is this language and communication and the ability of a child to speak 50 words. This was changed from a milestone of 24 months to 30 months. Now that is a 6-month difference. And 6 months in this early point of development is a huge, huge difference. Think about, in the beginning, say a baby that's just born to 6 months, huge difference in development, and then 6 months to 1 year. Well, the difference from 2 to 2.5 is really a big difference when you are looking at development, and especially in language, because this is when their brain is primed for language. This is the point where typically they start speaking a few words at about a year, and it really exponentially grows until they're speaking 2 words together by 24 months. And then, the amount of complexity in their language just goes on from there, because you think, okay, they start putting 2 words together at 2 years, and then maybe by 4, they're reading books. So, or certainly by 5, simple books. Although at the rate we're going, if we keep lowering these standards, who knows what will happen. But one of the problems I had with this is that in their goals, they kept saying, or they said, that they wanted to avoid a wait and see approach. And so to me, it seemed very odd that you would take a child who is supposed to be speaking 50 words at 24 months, and that is the normal milestone, and then push it up to 30 months. Because if you're waiting another 6 months for language development and there is a delay, you're waiting another 6 months to actually do something proactive about it. So I don't know, that didn't make sense to me. What do you guys think about that? Does that make sense to you? To push it further? Now, I could see if they changed it from 24 months to 20 months to say, hey, a child should be talking, at this rate, and then if that's not happening, hey, we better get on it. Because I am of the camp that you want to do things earlier rather than waiting, and this is one of the problems I have with the traditional medical community, because a lot of times I have patients come in and the medical doctors are saying, oh, well, let's just wait and see. They'll walk when they want and they'll talk when they want. And I'm like, no, it doesn't work that way. This is about neurologic development. And these milestones are windows into that development. And if it is not occurring in a sequential pattern in a predictable amount of time, then there is something going on that needs to be taken care of, because it's not going to get any better, and most of the time it gets worse and a bigger problem. So the American Speech Language Hearing Association, they're the gold standard, or considered the gold standard for milestones, says that fewer than 50 words by 24 months is a red flag for a language problem. So, that this band of experts was supposed to be looking at literature, but I'm questioning some of the literature that they were looking at and how they came up with switching from a huge gap from 24 months to 30 months. And they also seem to put more emphasis in this particular bracket for language and communication with gestures and pointing. And don't get me wrong, pointing is important. You want to see it happen by 18 months, but and for sure by 24 months, but having that replace actual verbal communication is not the answer. So let's just this is just to remind me to tell you, I did do a video on developmental milestones. I will put the link in the description so you can check it out. But what I do want to do right now is share my screen. And I want to talk about the actual article and show you how to look at these things. So this is the actual article. And if you scroll down, there's a little video. She just talks about, really, she just verbally says what a lot of this is saying that I summarized for you in my introduction, and went through the methods and the criteria, and then they had their table for the criteria, milestone identification, and literature review. And so they went through the criteria for that, and there were some resources that they looked at here, and then went to the evaluation and how they did that, and then the results. Now the results are in tables, and I do want to focus on the speech, but you can see here, you can go down to, they have this table here talking about the social emotional milestones. So you can look at that. It goes all the way down, and you can see all the way for the years, and you can view a larger portion of this, as I'm going to show you now, for the language and communication milestones. So I'm going to go down here, and you can see it says view large. Well, I've already created that, so I'm going to go right into it. And I wanted to, I've got it right open here to the says 50 words at 30 months. And then I just also wanted to show you for the 18 months, we've got pointing, something, asking for help, following directions given with both a gesture and words. So you can see some of the gestures there. And then 24 months, when they should be speaking quite a few words, point to things in a book when you ask, where is the bear? Well, to me at 24 months, when you say, instead of saying, where is the bear? At that point, you should be saying, what is that? And then the child will say, a bear. The pointing would come to me earlier on in the development. So pointing to two body parts, again, that comes earlier to me. Yes, they can point to them, but you should be able to say, what's this? And they should say nose by 24 months. These are things that we normally are talking about with children and they're reading about. So let's go back to the 30 months saying 50 words, which normally was at 24 months. And I want to just show you, this is where they said this is a new category here. This is a new thing that they put in here. And then this is the source of their data, the normative data, developmental screening and evaluation tools, and their published clinical opinion. So this is what you really want to look at. And I'm not going to go through everything, but I am going to show you that these numbers here, 30, 45, 55, relate to the reference. So if you go back to the original article and scroll down at the bottom, you can go right to, here we go, here's 30, and you can just click on Google Scholar. And then the other one was 45. I know that one of these was actually, some of them I think, okay, this is interesting here. So 45, if you click on Google Scholar, it will go to the actual article, and sometimes you can click on it and get the actual article. Sometimes there's a PDF. So this is an article that was written by the WHO indicators of infant and young development across 10 countries. So a meta-analysis through 0 to 3, and it goes through everything in there. And it started just talking about, they created a prototype tool So, this is what I'm also saying is just because somebody says something has been researched, I want to look at the research and say, well, how did you come up with children should have a milestone for speech at 30 months rather than 24? Where is the study that you actually did, or where was a study that was actually done that showed that this is actually where children are supposed to be speaking? Because I have a huge problem with sometimes when I'm looking at these resources or references, it doesn't actually support what they're saying. And we don't want to just take it on faith that just because an agency, the Centers for Disease Control, just because they said it, or the American Academy of Pediatrics said that this is so, and 8 experts came together and decided it was 30 months, why? Why did they make that decision? I would really be interested to know, because in my 30 years of practice and having my own 3 children, to me, 30 months is a delay for a child to be speaking 50 words. That's my expert opinion, and 30 years of seeing many, many children and helping them with many issues. So let's go back here. Let me go back to that 50 words. And then these over here, I clicked on before. And I think the only one, if you go to number 11 for the reference, this is going back to that American Speech Language Hearing Association, which is saying that it should be 24 months. So if this is one of the references, I don't know why they chose to say that. So you've got your, you can click on this and see what that development is, but we know what, I stated what they said, so it just doesn't make any sense. Let's go back here to 36 was Bright Futures. This was interesting because it is a big, huge, here we go here. This was done in 2017. It's a book, so it is a big, huge tome. And so I don't have the book, but it just talks about what they were looking for in this book in 2017. And again, it's 100 professionals looking at different spectrums of child health perspectives. So a lot of this is subjective. It's not really per se research, but they've divided the development into different areas, different times. So it's certainly great information, but again, is this supporting going from 24 months to 30 months? It doesn't look like it to me. And just one more example. I think this one actually, number 18, there was one in here that was probably the most pertinent. Developmental Milestones, a Pediatric Review. Maybe it was the one before that. 15 maybe. I know it was further down the list. Infant Growth and Development. Here we go. There's a PDF and a big, long thing to read, which is I think worth a read. But this was back from 2011. So actually, this is back from 1997. It was published in 2011. And again, this is not necessarily saying we should go from 24 to 30 months. So we have here at 24 months, they start saying, look at here, 50 words at 24 months. So their research they've put in here is actually backing up that children should be speaking 50 words at 24 months. They've actually disproven what they are recommending. So there you go. That is, that just goes to show you what anybody can say anything, but can they actually back it up? All right, so my big question is, what is the cause? If they are truly seeing that children are having developmental delays and they are seeing 75% of children meeting the speech milestone of 50 words at 30 months, why? Why are they seeing this delay? Well, I know they started this looking for the literature research a few years ago when face coverings were not an issue, but that certainly cannot be helping things in the present situation because there's so many things that go into speech. Speech is very complicated. There's a lot of mechanisms that go into speech. You have to be able to hear, okay? If you cannot hear, then you will not be able to process the sounds that are involved in hearing words being spoken to you. And if you cannot hear words that are being spoken to you, then you cannot know how to make those sounds. This is why deaf people have a hard time speaking. If they do speak, you notice that it's often sort of a monotone. The cadence and the speech, the timing is a little bit off. It's pretty miraculous when deaf people can actually speak without being able to hear sounds. It's pretty amazing. But think about this. I mean, as an adult who has pretty decent hearing, and I have developed my speech, so I don't have any delays there or problems there, when someone is covering their mouth, I cannot hear them properly. Oftentimes, I have to ask them to repeat what they're saying. So can you imagine a baby, a young child, a toddler who is learning language and learning how to speak? They are not going to be able to hear those sounds correctly, and therefore they are going to have a delay in language. So even if this is not part of what's happening with the CDC recommendations, if they do another evaluation, maybe a couple of years from now, if they're looking at literature, they may find that this is part of the problem. So this is something to consider. And it is really important too, not only for children to hear the sounds, but they watch the face. They watch how the lips form the words. And heaven forbid a child be having hearing issues, hard of hearing, where they're looking at the face for cues to determine what is being said, and someone has their face covered. How are they supposed to see what those lips are doing? And children who are having speech difficulties, when I'm asking them to form words, I tell them to look at my mouth, and you can see them looking and trying to follow the patterns that my mouth is making. So if this isn't part of the problem yet, it's going to be a huge problem for those areas that continue to cause children to wear face coverings and adults to wear face coverings who the children are looking to learn language from, especially if a child is in a school situation. Even preschools, because if they're 2 or older, some schools are requiring this, and the teacher is got a covering, and so that child is going to be at a disadvantage. The other thing that has to happen is children have to hear the words spoken on a continual basis. And I talk about this, I think I talk about it in the Milestone. Well, when my children were babies, I found myself continually talking all the time, like a monologue, just whatever, a running commentary of what I was doing and what was going on. And so they were continually bathed in language, even if it was just the two of us, so that they could constantly hear those sounds, because their brain is wired at that point for language. And this is why children have such an easy time learning languages, especially before the age of 10, because their brains soak it up. And then what happens is we have the potential when we're born to learn all languages, but then if we don't hear those sounds, those neurons in the brain get pruned away. So for me to learn Chinese now would be so difficult because those sounds are, they're not wired, and I'm not hardwired to learn those sounds. So if a child is not getting enough stimulation auditorily from people speaking to them and interacting, there's an engagement. One of the reasons why we speak is for social aspects, right? There's the social part. There's the ability to communicate what we want and what we need. So when a child is learning how to speak, sometimes they get very frustrated and have a tantrum because they cannot express themselves. So I've got a couple of pictures on the bottom there involving electronics. And children under the age of 2, for sure, should not be using any type of electronic at all. Nothing should be in their hands that's electronic. Not only for the aspect of their speech development, but that exposure for harmful electromagnetic frequencies that are literally cooking them on their body. So I say up until the age of 3, but once they get to a certain age, some electronics, maybe 20 minutes a day, preferably with a parent or someone who's there to interact and talk about what's on the screen and see what's going on. But a child sitting there with a tablet, scrolling, watching videos, they're not going to they're going to hear words, but they're not going to have that language communication. So even though you think, oh, it's an educational show, yeah, maybe a little, but if you're not there to interact with them, it's not going to have the same effect. And then there's the aspect too of parents who are completely addicted to their devices. So that's that bottom picture there. Mom and dad on their phones, baby sitting there, surprised the baby doesn't have something in their hands, but there's no engagement. If the parents are turned off and glued into the screens, that interaction with the child is also going to be affected, and the child won't hear the words, won't have that interaction and communication, and their speech may suffer because of that. So I have a question mark here because I do not have the answers, but these are some of the things that I think about. But as a chiropractor, one of the things I do know is that if a child, a baby, whoever, does not have the full access to their brain and nervous system, then things will not function optimally. So if there are any issues going on with your child, any milestone delays, speech delays, whatever the reason, and I prefer that they come in for a wellness visit so I can check things out as soon as possible and pick these things up as soon as possible, because there's so many things that can be done to help with the brain connections and with getting the communication going between the brain and the rest of the body, because the brain controls everything, every single thing in the brain, including speech. So my website is up there, Los Angeles-Chiropractor. There are so many things I can do in office. There's some I can do remotely for those that don't live in the Los Angeles area. Check out my other videos because I have a lot on development, and you might find something there to help you. But please reach out if you have any questions or any issues going on with your child that you want to ask to see if this is something that can help them. All right, I hope you have a great evening. If you're new, go ahead and give me a thumbs up. Actually, even if you're not new, thumbs up anyway. It does make a difference. It helps more people see this video, which may make a difference in their lives and the lives of their family. And go ahead and subscribe and hit the notification if you have not yet done that. All right, I will see you next time.